Our topic this morning is mental health in schools, and I am pleased to welcome to the program Shelli Reetz, who is the lower school counselor at the Harley School. Thank you for coming in.
Thanks for having me.
So the first question, I think, is one that's on the mind of a lot of parents these days, and it relates to anxiety and our children. Are our students facing more anxiety these days, in your opinion?
The data indicates that they are, for a variety of reasons. You know, there is an influence of social media and the comparison that students have one to another in a much larger context than what they've had in the past. Additionally, you know, they have access to much more information and news that can be stressful. Fear of school violence, a variety of topics that, that students are having to navigate and deal with in increased numbers than what they did in the past.
And educators are dealing with it as well in real time. What's been the approach at the Harley School? When you look at your students and you think about anxiety and stress, what are you doing to try to be proactive as it relates to helping them along?
Well, fortunately, New York State is a leader in this area with mental health education law. And so we at the Harley School are very happy and willing to include all of that in our instruction. It starts at the very earliest ages in our nursery program up through the upper school at all levels, working with social emotional learning. The counselors in the lower and middle school have implemented a multi-tier system of support, which means that we partner with classroom teachers so that all students are learning topics of self-awareness, self-regulation, social relationships, sound decision-making processes. And then we also work with students who might have more needs in small groups or individually. In the upper school, there's a peer-led support group for students dealing with stress and anxiety. And that's what I would say really separates the Harley School in a way, is that we include students in the conversation. So not only do we help guide them in their learning, but we're listening to what they need and responding accordingly.
Of course, students are in school for a part of the day and then they're at home and doing other activities the rest of the day. Parents want to know what they can do to help as well. Absolutely.
Well, there are lots of things that parents can do. First and foremost, thinking about mental health as part of wellness. We all have mental health, and so normalizing that and having it included in part of our natural conversations is important. Thinking about mental health in similar ways to what we think about physical health for our children, checking in, talking with the pediatrician, any behavior changes that concern us, to get their input, working with the resources available to us as parents at school, talking with the teachers, school counselors, school leaders, if we have concerns or notice changes in our children that we're unsure, is this a normal response for their developmental phase and process, or is this something that we need to be more concerned about? There's also a really helpful resource in New York State. The Mental Health Association of New York State provides a great number of resources for parents and educators on their website. So we can look there to know what is typical, what is something that should be more concerning, and when should I check in on my children and follow up with perhaps more help. School staff is also very helpful with connecting parents to community resources should they be needed, which is also very important.
Well, we view this as a really important topic. We're glad you spent a few minutes with us this morning. Great to meet you. Thanks for coming in.
Thanks very much. It was great to be here.
Shelli mentioned the State Mental Health Association. The website is mhanys.org. We'll share that link on our site as well at rochesterfirst.com.